Hi, my name is Evan. I am from the Washington Heights-Inwood Mask Block. I am here today with Daniel Besanov out in California, who is a clean air advocate and writes about it on his own Substack, suddenvalley.substack.com, and has also had quite the adventure both with doctors and with making your own homemade air purifiers. Do you want to talk about how you got into making Corsi Rosenthal boxes or homemade air purifiers?
Mhm. Yeah, of course. First, I want to thank you for the great work you're doing in your mask block, sharing the resources. And I think that's really amazing for the community having something like that. So thank you. And I'm really excited to, talk to you about what you're doing and some of the things I'm trying to do. Mhm. But yeah, I have been working on uh, my one of my first Corsi Rosenthal boxes. I've learned about them, I guess, a while ago, but I didn't think I would need it until I moved to my new home, which is next to a highway. So I thought it was especially important. I also have a baby on the way, so it's uh something I want to do for the baby and keep my family safe. And so yeah. Um, I guess my so that's how I kind of got started. I bought a bunch of commercial air purifiers, one for every room, and started researching more into them, and that's how I found out about using PC fans for to keep the noise down because the commercial air purifiers are all very loud, and I since I have some woodworking background, I realized I could probably make it from wood to make it look nicer. So that's what I'm working on right now.
Yeah, and yeah, so how did you figure out that PC fans could make the Corsi Rosenthal boxes quieter? Is there any particular story behind that, or you just looked it up?
Uh, I think I was just looking at different YouTube videos to learn more about it, and there's some great, you know, people who test various commercial products and also who do make DIY fans um and one of the commercial products in the market right now, it's called clean air kits. They have several I think it's a bunch of engineers that got together to make some fans for schools, and schools have regulation um how how loud a fan can be, not to disturb the classroom. So they figured out PC fans, they've been very competitive market, for PC fans to make them as quiet and as energy efficient as possible. So it turns out they work great for air purifiers as well, and they work with easily, broadly available, just your regular HVAC filter, your furnace filter, which are like $10 at Home Depot, and so there's no the advantage of PC fans is they're energy efficient, they're quiet. Uh, you can get them relatively cheaply. You can get, five fans for about, $35 or $7 per fan. And if you make a box, you can, if you make a box with two filters, you can make it relatively small, like smaller than a regular, four filter Corsair Osmond box. It's the traditional one with a big box fan. So they're thinner and they and they don't use proprietary filters, and
Yeah, what kind of filters do you use? I know we've talked before about making things affordable while still a good quality. So, what kind of filters do you use, and where are you able to get them from?
so I'm using the 3M Filtret. I don't know if that's how you pronounce it, but I get them at Costco. They're about, $50 for four, and sometimes they go on sale. So, uh, but and I get the Merv 14 filters, which is they're about 90% efficient at capturing uh, particles at 2.5 microns, which is, 2.5 uh, P 2.5, I think that's how you say. PM 2.5. So
That's how
so
I've seen it anyway.
and of course HEPA filters are 99.97% efficient at capturing like even the smallest particles, like zero point 0.3 microns. So it's nowhere near as good as a HEPA, but uh, they do capture a lot of the air pollution that's out there, outdoor and indoor.
Yeah, and I know you being in Southern California, I'm sure that's helped with wildfire smoke and such as well, right?
Yeah, yeah, definitely very important for wildfire smoke. I know in Minnesota, and Canada, they had a lot of wildfires this summer, so it was really bad. And I recently visited family there, and I made them my first CR box when I was there. I just went to Costco. They had the filters, the 20 by 30, the largest ones, and they had a box fan. So everything came out to like just over $100, and I used duct tape. And it was kind of amazing how easy it was, and it has really good efficiency, in terms of CFM, uh, cubic feet per minute. I, I don't know exactly, but I'm sure it's comparable to some of the best commercial fans out there.
Yeah, I've certainly heard really good things about, the Corseros and Thal boxes, which, I'm no expert, which is exactly why I wanted to talk to folks like you. So, but like that's really good to hear. And I assume at that point you were using cardboard, or were you already using wood to, connect everything together?
So I didn't have access to any of my, workshop and tools, and I wanted to make I didn't have much time. So I just used the box fan, the filters, and duct tape. That's it. No other materials. I thought uh, I would need cardboard, but I just put the box fan on top of the, four filters. I taped the filters up, side by side like this, and I didn't need to tape the bottom because you just keep it on the ground. I checked, there was no leaks, but if you wanted to, you can even use the box from the box fan and cut it to size and tape it to the bottom. So amazingly, it worked pretty well.
That's so cool that you were able to do it with like the bare minimum, like not even cardboard. And like that's fantastic. I'm sure there are a lot of people out there who can't afford the commercial stuff even if they wanted it. And, that makes it so much easier. Did you have to get any additional like electronics to like hook things up and connect them to power or anything, or was it literally just duct tape, the fan, and the filters?
Yeah, no, I didn't need to get anything else. The fan, um, just use the fan's power. I think your cat is joining us. Hello.
Yeah. Yeah, she's trying to steal my dinner right now.
Well, I mean, talking about pets, it's great for allergens if you have any pet allergies. Um, air filters do wonder, air purifiers.
Yeah.
So, so yeah, just literally the plug um for, for the box fan from the box fan. I can show you a photo. I don't know if it'll render here.
Yeah,
Can
amazing.
you
Yeah,
see?
and like yeah, we can see it. Yeah, we can see it. Yeah, like it's
Kind of,
kind of getting blurred and unblurred now, but like that's
yes.
gonna yeah, that's gonna be fantastic because like I usually upload the video as well, so like that way folks who are watching the video can see what you're talking about. So that's great. And yeah, so when did the idea come for using wood instead of cardboard for the CR boxes?
Um, so I guess I was inspired because I wanted to make I needed new bedside tables and nightstands. And, the nightstands we're using, they're like from IKEA, 15 years old, and like they're metal. So maybe it's time to upgrade. And I was looking on, Facebook Marketplace and some stores, and none of them really had the design I wanted. So I thought I can probably make some that I would like and probably even cheaper than the ones available on the market. Because what I like is, the Scandinavian kind of style and like minimalist on, no drawers basically. So just a very minimalist and nice looking, mid-century design. And as I was looking at that, I also saw how, IKEA has a nightstand that has an actually integrated air purifier in it. I forget what it's called, but and there is also a side table by another commercial. I believe it's Blue Air has also a side table air purifier that you can put stuff on top, and that kind of gave me an idea. What if I make a nightstand with an integrated air purifier, using PC fans? And the biggest drawbacks of big CR box is the traditional CR box is it's it's big. It's it's not the most pleasant to look at, right? It's, even my family, I'm sure they're not too happy about looking at that thing all the time. They're very loud, so you can definitely hear them even on the lowest setting, and they're energy not very energy efficient. They they draw quite a bit, and the a wooden air purifier, the advantages, it's earth tones. You can make it into out of any wood. You can um there's actually for me, I think furniture in my place really affects my mood and my just my well-being overall. I think it's an area of research that has a lot of potential. I believe it's called biophilic design. Um, and there's this Harvard professor of public health called Joseph Allen. He's a director of the Healthy Buildings program who talks about it. Who just, he wrote a book in 22 called Healthy Buildings. He's talking about biophilic design, how that's an area of um, that we can look at to improve, part of like, air quality and temperature and humidity and all those things that improve people's well-being. Because, I want to have something that's pleasant to look at and that makes me happy to look at. Um, so that's, and also I have some experience woodworking. I, I took I got a certificate at a local, community college um, you know, basic woodworking skills. So, and I have an access to a woodworking shop. So I'm pretty lucky in that respect. Hmm. So I knew, it was something within my skills, and I was pretty excited to try it. And right now I'm in the process of making. I just figured out a how to make dovetails for my dovetail jig with a dovetail jig, and that way I can make, more of them and give away to family and friends.
Yeah, and for those of us who are absolutely terrible at woodworking, what is a dovetail jig? Did
Oh,
I say
sorry.
that right?
Yes. Of course, sorry. So dovetail is a type of joinery which is it has pins and tails, and it goes like this to connect two boards perpendicularly. And if you Google it, you'll see some examples of dovetail joinery. Um, it, it looks, very pleasing because um, it has this transition between end grain and face grain, and it's pretty intricate. Usually, it needs to be made by hand. It takes a lot of work. So I guess you don't see much dovetail, joinery in today's world or furniture. It's mostly um, consigned to like craft woodworking and hand woodworking, which is kind of a dying art, unfortunately.
Yeah, that's really amazing. And as you were speaking, I looked it up. And for those who may just be listening, it is, Daniel kind of showed with his fingers that it's like interlocking pieces, and it's that kind of classic design where it's, that up and down pattern on each side, so that it really does interlock, which is so cool and amazing that you're doing that kind of stuff by hand. Um, and yeah, so you were saying that you have access to a woodworking studio and you're starting to make enough stuff that you're able to give out to friends and family. Do you have any advice for folks who may not have access to a woodworking studio?
Uh, so yeah, definitely. Um, unfortunately, there's not many wooden air purifiers in the market. In fact, I don't know of any as of now, but you know, I think there should be more. I think the idea of integrating air purification into furniture, like nightstands or TV stands or side tables, that's something that's really a missed opportunity that could be explored. And it's not that hard to do, And for people who don't have access to that, they can definitely make, you know, a PC air purifier. It's a little more complicated than a traditional CR box, but there are guides online that people can follow that describe the materials. You can use cardboard. You do need to cut out those circles, and so it does take a little of craftiness. And the electronic components could be a little bit intimidating, but there's not too many of them. It's just PC fans, connections for the PC fans. It's kind of like splitters that connect to a DC power outlet. Hmm. And for the advantages I mentioned, um, it's very energy efficient. Basically, it's about takes about 8 watts for 5 PC fans, which is equivalent to an LED light bulb. So it might add $20 or per year of energy cost, but the returns are on health are um, tremendous. But yeah, very good point. Very good question. I would recommend you can just use cardboard, just
Yeah.
or hardboard, like
Yeah, and
mhm.
I think I remember last week at some point you were saying that you were able to find, really affordable, just like planks of wood that you were able to use for your situation. Do you remember like where you found them or how you came upon like affordable slabs of wood?
Um, well, I didn't go to any special place, just a standard store that sells wood. Uh, should be one in every city, just even Home Depot might have some, but I'm sure there's some specialty shops that sell like big boards. Sometimes you can get shorter boards. Um, but the wood that I bought, it was about 7 or 8 board feet. And for walnut, the cost is about maybe $15 a board foot. So everything came out just about $100, maybe $140. And that was enough for me to make 2 air purifiers. Um, one large one with 10 PC fans and one smaller one with like maybe 5.
Yeah, that's so cool. Yeah, and do you write at all about your adventures with figuring this stuff out on your Substack?
That's a good idea. I should do that. I definitely plan to do that for once I'm finished with it and I figured it out and I can maybe publish a guide of how to do it for others who may have access to a wood shop. And also I want to um, make a guide for those who don't, maybe with just hardboard or cardboard, uh, some simple step-by-step instructions. I think, but there's already a lot available. I think maybe I can,
Yeah.
write my own experience. I'm already taking videos of everything I'm doing, so I'll publish a video as well.
Yeah, that's amazing. I'll for sure link to your Substack in the show notes once I put the podcast out. And I'll also look for links to those instructions that you were referencing because I'm sure a lot of people would find those to be very useful. As you said, it can look intimidating, but like you're the second person I know who like is just an absolute whiz at this stuff. So I'm sure
Oh,
yeah. It sounds like it's something that a lot of people can do at home, especially like you said earlier, like, when you had to kind of jigger things together last minute, it's something that you absolutely can do. Yeah, and uh, do you have any plans to expand what you're doing, or do you know of people who like are like maybe lending out, air purifiers or CR boxes?
um, I, you know, so far I just have plans to, give out to friends and family, and obviously, publishing the guides and the plans. But I see, there are businesses who are and individuals who are making that, for commercial sale. As I mentioned, there's clean air kits, which are, you know, a little bit expensive upfront, but they still use those available, furnace filters, and over time they definitely save a lot of money. And they look good. They have some that use I believe MDF, but and some that use hardboard. And there are many creators on Etsy that sell like 3D printed parts, or uh, there are, I think it's a space that's definitely can have a lot more creativity and a lot more people in it to
Yeah.
be making more welcoming to people.
Yeah, agreed. Like I've heard of a couple of lending libraries that lend out air
Mm.
purifiers and such. I know I just recently talked to somebody who was reaching out to their local mask block. I know some mask blocks are able to do that. I'm hoping someday mine will be able to, but not yet. Um, but yeah, I'll probably also link to, the global mask block directory in the show notes so people can search to see if there are any such resources in their areas. Um, but yeah, is there anything else that I've missed so far that you'd like to talk about regarding your air purifier adventures?
Um, well, I guess I didn't talk much about the benefits of air purifiers and why should we talked about, obviously, wildfire smoke is a big one, but hmm, uh, air purification and ventilation are some of the biggest changes that we can take, and they're relatively small changes that could improve our health significantly. I think throughout the pandemic, we focused on mitigation strategies like, you know, um, like tracing, contact tracing, and um, social distancing, quarantine, which are all important. But I think what we missed, a crucial, puzzle piece of the puzzle, is air purification. If we could have invested all that money that we spent on contact tracing instead of upgrading our schools and our office buildings and our homes, that would have reduced transmission by a huge, huge margin. And I just want to read some benefits of increasing ventilation and filtration. This is from the Healthy Buildings book by Joseph Allen, um, and John Macomber. It takes a little bit of a business perspective because they realize that uh, you know people need some in incentives to make those changes. They're not going to do it just because. Um, so there is a 5% of lung cancer deaths globally are attributable to particulate matter, and mortality rates increased by 7% for every 10 micrograms per cubic meter of PM 2.5. Hospital admissions increased by over 4% for every 10 microgram increase in long-term PM 2.5 per cubic meter. And the cognitive testing, for school related to schools, cognitive testing of students shows a 5% decrease in power of attention in poorly ventilated classrooms. Um, in a study of over 4,000 sixth graders, lower ventilation rates, moisture, and dampness, and inadequate ventilation were all independently associated with a higher incidence of respiratory symptoms. Inadequate ventilation was also associated with more missed school days. So these are just some of the benefits. Um, and another, you know, factor that I want to remind people is that we spend majority of our time indoors. When we talk about clean air, we think about, the Clean Air Act for it's only outside, but in fact, 75% of people's exposure to outdoor air pollution actually occurs indoors. Just because outside air seeps into our buildings, and we spend so much time, we spend over 90% of our time indoors. Uh, you know, to put it in perspective, whales spend less time than that in water, underwater than we spend indoors. Like, so, and we spend like a third of our lives in one room, our bedroom. So at least have an air purifier in your bedroom, proper ventilation. Um, it has a lot of, health benefits, and plus, of course, filtering viruses, like COVID, um, like influenza. There's many other things. There's allergens. There are microplastics. There are, wildfire smoke. There's asbestos. There's those forever chemicals that shed from our furniture.
PFAS,
Just
I think. Yeah,
PFAS,
yeah, I
exactly.
forget what it stands for, but yeah.
Yeah, nobody knows. And there's, of course, the volatile organic compounds from cooking, and so it it has the for especially, it's not only for homes, it's also for businesses and for schools. I think it's a huge missed opportunity. It would reduce absences. There's some studies that show, there's over, PubMed listed over 7,000 scientific papers on particulate matter 2.5 um, micrometers, which is, a grain of sand is 100 micrometers, and and even sand can travel miles over oceans. So this is all airborne particles, and respiratory droplets are about 5 micrometers, and that contain viruses. So a filter that filters out 90% of those particles will also filter out many viruses, and it reduces absences, by as much as like 1% per year. So about two working days per year, people miss fewer if there is proper ventilation. So right now, we don't have any standards for indoor air ventilation and indoor air quality like we do for like outside air. And it's something that hopefully will change soon. We need laws, because we can't just expect people to protect themselves. You can buy an air purifier, but you need much more than that. What about school? What about work? Like you can't lug around an air purifier with you everywhere you go. I mean, you can wear a mask. That's a filter as well. That's a great um that's a great solution, but realistically, uh most people aren't gonna do that. So
Yeah,
so
exactly.
having clean air is very important.
Exactly. And, I often talk about, one-way masking is great and so, so much better than nothing, but it's nowhere near as good as two-way masking, and unfortunately, we even see medical doctors throwing fits about masking these days. As I think you've had an experience with, and if you want to talk about that, like I would, love to, touch on that as well. But the fact that on an individual level, we can only control so much. Like it's all about layers, 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 and improving air filtration is such an important layer among those layers. And like while we're on this subject, like I know you've had some adventures, trying to stay healthy at the doctors and stay safe at the doctors. Is that something that you would feel comfortable talking about?
Yeah, definitely. I'm sure I'm not the only one. I think everybody who is conscious about their health, who wants their doctors to protect them, and whoever asked a doctor about masking had a similar experience. Um, you know, the first time I asked my doctor to wear an N95 mask, uh, she uh, she agreed. But when I showed up, none of the staff at the check-in desk were wearing masks, even surgical masks. So I asked, politely, of course, if they could put one on, and it seemed like they weren't even aware of my request or of the policy that, my health system had that if a patient asks that they should put on a mask. So So they gave me excuses like, oh, COVID is not a big deal anymore, or there's no COVID anymore, I'm not sick. And and when I saw my doctor, she challenged me as well, even though she agreed to wear an N95, and she did, but she said, we're 5 years into the pandemic, you know, why are you still worried about this? And, I had to just, I pointed out that uh, there's still at the time 1,000 people dying a week. There are 17 million people living with long COVID. There's 7 million immunocompromised people, and it's as a doctor, it's her responsibility to protect her patients. And but the next time I asked, I got warning letter um, you know, from my doctor saying that basically because I asked too many times repeatedly for them to wear a mask. Um, and of course that was upsetting, but I responded with all the documentation about all our interaction, which was mostly just me trying to clarify the policy. Um, and eventually I decided to change doctors because I just didn't feel like I could um I could receive the proper care.
Yeah, that's like really scary stuff. And like you said, like doctors are supposed to be protecting their patients' health. And it sounds like you ended up having to move good doctors completely. Have you had any luck with finding a new doctor who is more receptive to your requests?
Um, no, I decided to, unfortunately, I decided, not to ask my new doctor because I don't know if any doctors mask in my, in my area, and it's so hard. I was lucky I was able to find a new doctor. I know for a lot of people it's not even an option. I mean, it's not like changing a hairdresser. It's uh, this is something that takes, months or years for people to do, and even if their insurance allows. So, um, so I'm lucky I was able to do that, but it's unfortunate because doctors don't, they don't think masking is important because people don't ask, but people don't ask because they get retaliated against. Even if they don't ask, some people get mocked for wearing a mask. At my first appointment with my doctor, I didn't even bring up my masking, but my nurse asked me if I'm sick or why am I wearing a respirator. So, um, so it's not just, part of it is they might not know about the ongoing risk of COVID and long COVID, and that it's not, every infection carries a risk of harm for even for, healthy individuals. Um, but also, even if they do know about it, they're knowingly, you know, some doctors are knowingly okay giving an infection to a doctor, to a patient, to their patient. I mean, even before the pandemic, most there's studies, plenty of studies that shows most healthcare professionals have come in to work sick knowingly, and a lot of them knowingly gave, an infection to their patient or know somebody else who did. And I mean, 100,000 people were dying every year just from hospital-acquired infections. And that was before COVID. So it's unfortunate. I think there needs to be a systemic change of universal masking in healthcare settings. It's necessary to protect patients, and so they don't go through the unfortunate experience of trying to negotiate, their own protection.
Yeah, that's so true. And that's been like a big frustration for me, seeing masking go away largely in most healthcare settings, even where, at least from my impression, and certainly, I've never worked in hospitals myself, so take this with a grain of salt, but, my impression has been that, right, from talking to RNs and such, that things have gotten worse compared to decades ago when you would get a serious bureaucratic legal smackdown if you would say went into a TB ward knowingly without a mask on, or at least go into a patient's room without a mask on if you knew they had TB or whatever other airborne infection. And I do hope we can see, to your point, both improved air quality and, you know, increased uptake of masking in medical settings precisely for the reasons you outlined. And it's also amazing to me. Like, I'm here on the East Coast and I'm frustrated, but at least when I ask my, GP to mask, he's on it. And to hear other parts of the country, like, the doctors throw outright fits, it's scary stuff. Yeah, and to your point there, COVID isn't the only airborne illness out there that we have to defend against. The flu still kills people. Um, but yeah, is have it as somebody who has been dealing with a lot of medical nonsense trying to protect both yourself and your family. Do you have any tips you'd like to give people on the patient end, or just messages you'd like people to hear on that front?
I mean, that's a, biggest question, right? That's what can we all do? That's a really good question to protect ourselves and I think it's unfair for patients to put themselves at risk of retaliation by asking their providers to mask. Um, a lot of providers are not are not receptive about it, they're uninformed, and they don't like to be uh, you know, to be that their patients know more than them, unfortunately, about respiratory infections. So what what I've been doing, is small whatever small part is, donating to my mask block. Like, um, if you have any extra masks or um, maybe if I make enough air purifiers, I'll donate some or COVID tests. If you can always talk to your representative, you can also always email or call. You can talk. You can make public comment to the CDC advisory committee. Um, well, which actually was dissolved, so never mind on that. The HICPAC. Uh, I believe it's a um, healthcare and infection practices, something. But you can write about it or talk about it with your friends. Um, any small change makes a difference. I think you can join organizations like WHN, World Health Network, which is a great organization of people committed to, you know, protecting each other and educating people. So there are a lot of things you can do, but maybe not. Unfortunately, maybe not directly. I, if you're brave, you can definitely do that. But just, I hope you have some support if you get pushed back. Maybe bring an advocate with you to a doctor. Definitely.
Yeah, yeah, that is such wonderful advice, all of it. And I just looked it up. It's Healthcare Infection Control Practices Advisory Committee. Um, so there we go.
That.
At least we got one acronym in there. Um, but yeah, and I know um as of the time of recording this anyway, we're recording this on the 17th, and I believe tomorrow and or the 19th, the Vaccine Advisory Committee, the Federal Vaccine Advisory Committee is having its hearings. I think it is too late for people to sign up to testify, and almost definitely because that date will probably be passed by the time I post this interview. But like, I know there are some of us who have signed up to testify. I believe I am scheduled for tomorrow, like late afternoon sometime. So fingers crossed. But yeah, there are like a ton of opportunities, like even just for like at least here in New York, city council hearings are, open to all, and they even have an option for you to zoom in to give your public testimony if that's safer for you. And like I know the uh, Health and Hospitals Committee and other healthcare city council committees here often have hearings on various things. I think on the 19th here, they're having a hearing on the Legionnaire's outbreak here, which happened in Harlem, primarily in Harlem, I believe, which like right smack dab in the middle of my old neighborhood. Scary stuff. So yeah, I will also probably be testifying there about the need for disease prevention, of certain qualities. Do you have anything similar out in Southern California?
Um,
It's okay if you don't know.
I mean, the ACIP, the Advisory Committee on Infection Practices, definitely. I signed up to speak. I wasn't picked, uh, but definitely, attend maybe school board meetings to encourage installing ventilation. Maybe talk to your building manager about proper ventilation, not turning off, you know, the f- the fans after 5 p.m. or because saving electricity, maybe even if you save 20% of electricity, that's less than half of a percent of, total expenditures for a business versus the benefits of, even doubling ventilation rates could increase revenue by 10%. That, that's a giant difference. And, I think we should be focusing on people. Um, so, funny you mentioned Legionnaire's disease because the book I mentioned, Healthy Buildings, like, that was one of the inspirations for um, the Joe Allen, the author. He um, he investigated an outbreak at a hospital and where one person died from Legionnaire's disease, and he quoted them um, that he can, his team can basically improve the building to make sure there's no such outbreak for only $20,000, and which he thought was really cheap, but amazingly, the hospital balked at the fee and they rejected it. So even, a clear-cut case where an outbreak at a hospital killed a patient, the hospital refused to pay a small sum of $20,000 to prevent other patients from, and many more got sick. Of course, Legionnaire disease doesn't kill everybody, but from infecting people and from killing people. So it's something that's definitely needs to be codified, not left to individuals to decide these kind of decisions.
Yeah, that actually makes me think. I think at some point last week, during our WHN meeting last week, we actually got onto the subject of reticence to, do what at least we think of as pretty basic prevention measures. Like seems to be a certain mindset around resistance to like even just so much as like when seat belts first started getting implemented, like there was huge resistance to that. Goodness knows, I'm pretty sure I still know people who are resistant to seat belts. But yeah, I think yeah. You had a great phrase for it. What was that phrase? What do you call it?
Oh, the Semmelweis reflex, is that
Yeah,
it?
yeah, that's
Yes.
it. After the guy who discovered or at least, popularized washing your hands, right? Yeah.
Yeah, that was before, the germ theory of disease, but he noticed that some doctors who came straight from autopsies, they just washed their hands with soap and water just to get rid of grime, but still bacteria was in there, and they went to delivery rooms where about 10% of their deliveries resulted in the death of the child and the mother, and people who also sanitized their hands, or nurses who sanitized their hands with um, like a chlorine, very low concentration chlorine solution, which killed off the bacteria. Those had only 1 or 2% uh, death rate for deliveries. So, and his colleagues laughed at him. They locked him up in a mental hospital where he died from beatings. He is now called the savior of mothers. And obviously, years later, when the germ theory was accepted, and finally people realized they how important um, hand sanitation is, and but still, it seems like the story repeats itself with gloves during the AIDS epidemic, and with now it's with masking. I hope we I hope that we would learn something from this pandemic where so many people died, but it seems like doctors are less willing to wear masks now than they were even before. We're less prepared to um, to respond to a future pandemic.
Uh,
And as you said, like seat belts, there's resistance to other public health measures like drinking and driving. I mean, anything new, even right now in where I am in Southern California, there's resistance to roundabouts, you know, which are safer for bikers and they're like I think they just are tearing one down. They built it, now they're spending all this money to tear it down because of public outcry. So it's just progress is very slow, and I hope um with more people knowing about it and finding out about it will change the attitudes. There's many reasons. There's very complex reasons. It's very hard to change the momentum of, it has to start with like all the way down from contractors who build the buildings and um it's many, incentives that need to be adjusted.
Yeah, at risk of getting into pure speculation that may be outside of either of our expertise, do you have any thoughts on why people like may be so resistant to that change and or any ways that you found success in like moving the needle or pushing people, toward these changes a little bit?
I mean, it's a great question. Um, from my perspective, what I see is a lot of pandemic fatigue. People just don't want to think about it. Um, mask itself is like a symbol of the pandemic. It's a reminder of all the trauma that we went through, how many people died, children losing their um, parents, you know, there's a mask carries a stigma, it's a reminder that we're all vulnerable to getting sick. Nobody wants to admit that. It's maybe it's also a tacit judgment on others that if I'm protecting you, why aren't you doing the same? And people don't like that, even if you don't say anything. And there's people are very tired of judgment from from early in the pandemic, early days. Um, it also reminds people of government overreach, where which I think it's a little bit overblown because the classic lockdowns only lasted maybe 2 months, and schools were closed not because of um, government mandates, but because the teachers union is so powerful and they wanted to protect themselves, the teachers, and so there's part of it is misremembering, history of what happened. Part of it is of course, psychological factors and mental gymnastics people do that people right now have been infected, what, like 4 or 5 times on average. And if they've been infected so much without taking any precautions, they want to believe that COVID is mild. I mean, they don't want to believe that it might cause, it's a vascular disease that causes damage to basically every system of the body. Um, that there is a risk of cumulative damage, and it decreases healthy lifespan. It affects, the brain, the heart, the lungs, the vessels, blood vessels, and those, uh, the cumulative damage shows up in small ways that we don't quite know. There's a lot of we don't know about because it's such a new virus. But just like, other uh, carcinogens like leaded gasoline, we're just finding out how it really affects, 30 years later after we took away lead from gasoline, that we're finding out how it lowered, people's IQs by something like 5 or 7 points on average, and caused all sorts of health issues that we're already learning a lot about negative health effects from COVID, but I think we're definitely going to learn much more in the years to come.
Yeah, that's a great point. And if hopefully I will remember because I know I'm already planning to link to quite a few resources in this episode, so fingers crossed. But I do know that WHN had a great article about, the effects of COVID on different parts of the body. And to your point, every COVID infection is a cumulative risk, the risk factor for long COVID. It's not just that, the more infections you have, the more chances you have. It literally compounds it to, as a potential risk of long COVID. According to at least one study I've seen, uh, um, and like you said, like even like I know former athletes, formerly peak condition, constantly exercising, eating healthy, who now, you know, have trouble getting out of bed some days because of long COVID, so it's something that can affect even healthy people, which I think a lot of people don't realize. And, unfortunately, it's thankfully a lower risk with vaccines, but it's still a risk with vaccines because I feel like we have this perception of like either you get the anti-vaxxers who are like, vaccines, or, often on the other end, you have people who would say, well, we have some vaccines that are neutralizing, so this must be a magic bullet, and it isn't. And, so, sorry for my cat.
Oh no, it's the cat loves to be on camera. I love
Yeah.
it.
But yeah, I just blathered on way more than I intended to, but yeah, do you have any other advice or things you would like people to know before I let you go and stop hogging your time?
Um, I think we covered a lot. If there's anything, maybe hope people realize, talking to like why people don't mask, when both, the government and the media are tell us that COVID is over and COVID is mild, it's very hard um, to go against that narrative. And of course, there are many, many studies right now that are coming out by many experts um, in Yale and in many other institutions that show the cumulative damage from COVID that we're not just starting to understand. And it'll take the medical community a while to accept that COVID causes disability, and we're not there yet. But if we use the precautionary principle, we need to act now and protect ourselves. Wear a mask in public anytime you go indoors. Um, to, and also, I hope people feel, you know, responsible for others' health as well, that you're not just protecting yourself, you're protecting other people, you're protecting somebody's grandma, you're protecting somebody's sister or wife or child. I went to my doctor's office today and um, with my wife, and the perinatologist was not wearing a mask who was doing the ultrasound. And pregnant women, they're especially at risk of complications from COVID. And babies, they don't have an immune system at all. So uh, it's very bad for the baby, to catch it. So even in a pregnancy ward where there's so many vulnerable people, the check-in staff, nobody was wearing masks. So it's uh, just very sad, and I feel you know I just feel very disheartened that we aren't there yet, and we're putting so many people in danger. Also important to realize COVID is um asymptomatic transmission is very common. It's maybe half of all infections. So COVID is airborne. It's you know around half of infections are asymptomatic, so you wouldn't even know if you're sick. Hmm. You can still infect others, um, and especially those who cannot protect themselves. Vaccine doesn't work as well for immunocompromised people. So we're just basically abandoning them and telling them to stay home and out of society's view. I think that's cruel. Um, you know, if if somebody is not free in our society, I don't feel like I'm free. So I'll keep working until, and I know a lot of people are doing that as well, until there are, universal healthcare, universal masking healthcare at least, and um, proper, clean air ventilation laws and for indoor spaces.
Yeah, and I know that's like a really depressing note to end on, but yeah, to give us a little upbeat note, it is really amazing that we have people like you out there doing your part, fighting the good fight, whether that's, talking to people or, like making air purifiers, CR boxes or whatever, like even these like little things of, hey, I have access to a woodworking shop and I can make these really beautiful Corsi Rosenthal air purifiers for my friends and family. Like every little thing it counts. So thank you so, so much for everything that you're doing and for letting me hog so much of your time today. So have a lovely, lovely rest of your day and thank you.